Good morning. Okay, this is a case of bilateral inguinal hernia, and we are planning to do a eTEP repair here for this patient. And here you see that this is the marking for pubic symphysis, and this is almost 16-17 centimeters from pubic symphysis, right? So for eTEP approach, first we need to go 3 centimeters approximately above the umbilicus and almost 5 centimeter lateral. So this is the marking from where we'll do the entry, right? Then this is the midline that you see, and if you mark it onto the lateral side, it is 7.5 centimeter on this side and it's 7.5 on this side. So this is almost 7.5. This is the marking of linea semilinaris. And if you mark the level of arcuate lines, it's almost roughly at the junction of 1/3 and 2/3 between umbilicus and pubic bone. So it should be somewhere here, around here, right? Sure. So once we start it, first we go vertical, directly vertical. You can see the fatty layers there. And then once you encounter the anterior to sheath, this is the anterior to sheath. Can you appreciate that the white is thing? Then you need to be slightly slower, right? So you see the anterior to sheath there. You can do movements on both sides, or you can do it on either side, whichever you are comfortable with. And then the muscle that you see registering, once you see the whitish thing on the tip, the white dot that is posterior to sheath, you drop down the trocar. And this is the time where you might feel some amount of resistance. Then you need to lift the left hand when you are entering here. You can lift it slightly and then turn it around. Then there will be some loss of resistance that you might feel, and you are into the correct place. Then you should insufflate, and when you can connect the gas here. Yeah, connected. Now we have connected the gas. Can you appreciate the Nemo that is helping us to dissect now? Now you can dissect it like this also by sideways movement when you are doing it. You can just use the tip of the trocar for this blunt dissection kind of thing. You can use the sharper edge of the trocar here, or by just sideways movement. And at this moment you need to be flush to posterior tissue. Just go in and do this blunt dissection with the help of camera. And you need to be into the irregular space here, the whitish, the cobweb that you see, that is where you need to do the dissection. You need to go lateral to create the space along the linea semilinaris. Can you appreciate this vessel there? Probably that is the inferior gastric vessel. So we need to create space laterally as well. At this moment we can also switch to 30 degree. That makes our life slightly easier. Can you appreciate this vessel here? This is the inferior gastric vessel. Now we'll switch to 30 degree and we'll continue the dissection further. So we have done some amount of blood dissection here with the help of camera. Now we are just planning to put our working pose. So here you see inferior gastric vessel. Can you appreciate that for me? And this is probably the level of arcuate line. Right? Now, so what we'll do now, we'll palpate it from externally. इधर दिखाएंगे नहीं एक बार उधर ही दिखाएंगे. So you see this is the level probably where we are going to place our needle first, followed by the trocar. You see the inferior gastric vessel there. So we are putting a needle and a trocar lateral to this under vision. So first we are going to place अब इधर दिखाएंगे. Now what we are going to do, needle. What we are going to do, we are just उधर भी देखो. Now we are, you see, the needle is coming there, right? The needle is there. यहाँ दिखाएंगे एक बार, show me. ठीक है. Now we'll place in a trocar, and at the same time we'll also need to ensure that we are away from any bony prominences. So this is our ASIS. We are 3 finger breadths away from here. So I'm just going to make an incision here for 5 port, working port, almost at the level of arcuate lines. And under needle guidance, I'm just trying to feel the direction of the needle where I placed it, and then I'll place it in the same space. I'll put the now my trocar is coming there. Right? So we have created some amount of space here. You can see the dissection that has been done on left side here. My left port I have used. I have used my left hand from here to create this space. Show there. I have created this space here, and then I have divided medial end of PRS and this arcuate from the level of arcuate line. We have decided to divide some amount of PRS here, and once I am sure that my needle is going to be placed in the proper place, and I have created some space. Now before dividing this, I need to ensure that there is no posterior peritoneum here. So I just bluntly dissect it first, and then I divide it from there. So if I need to divide, I divide it like this, right? So once I am sure that I have done adequate dissection, then show here. Then I'll put a needle under guidance from here. Under दिखाओ. See, the needle is coming here, exactly where I wanted it to come. Now I'll place my right hand working port here, and since this was a hernia, the right hernia was slightly bigger, I'm doing right side first, and I've done entry from the left side, and then I proceed on to the next side. Stop. Once we are done with the dissection of right-sided hernia, we place our final port, working port, that is right lower quadrant port under vision, and this is the final image of working ports. Thank you.